Life after 50 can be one of the best chapters, but it's also when small mistakes can have big consequences, like a fall that leads to months of recovery or a simple health oversight that turns into something serious. I'm Dr. Barron, and today I'll share 10 important things people over 50 need to know to stay strong, healthy, and independent. Number 1. After 50, bone density declines at a rate of about 0.5 to 1% per year in men and 1 to 2% per year in women. And that loss is even faster in the first 5 years after menopause because of decline in estrogen and progesterone. Over time, this silent reduction in bone density increases your risk for fractures. But why wait until you actually get diagnosed with osteoporosis? We do indeed have powerful treatments for osteoporosis, but medications come with side effects and risks. We should focus on prevention. Protect your bones now before the problem starts, so you might never need medication in the first place. Make sure your vitamin D levels are normal, since vitamin D is critical for calcium absorption and bone health. It is important to do resistance or strength training at least 2 or 3 times per week using weights or resistance bands. Also, add balance exercises at least 5 days a week, like standing on one foot for 20 to 30 seconds. This strengthens the muscles in the feet and legs and improves coordination. Number 2. Many women over 50 live with symptoms like hot flashes, night sweats, mood swings, low libido, and vaginal dryness, often because they don't realize safe and effective treatments are available. Bioidentical hormone therapy with estradiol, estriol, and progesterones can make a dramatic difference. Hormones can reduce hot flashes and night sweats, improve sleep quality and mood, support bone density, and boost energy levels and overall well-being. For low libido, I've seen many women benefit from compounded testosterone creams or sublingual oxytocin. For vaginal dryness or discomfort, DHEA suppositories and estriol creams can improve not just discomfort, but also urinary frequency and irritation, which many women don't realize are related to menopause. Another important benefit is the impact on relationships. Hormonal changes often lead to a mismatch in sex drive between partners. This can cause frustration and distance even in the strongest relationships. Don't wait until you drift apart. Restoring hormonal balance can help improve intimacy, emotional connection, and relationship satisfaction. I wanted to share a quick, funny story. One Friday afternoon, my assistant rushed into my office to tell me that a patient's husband was on the phone with an emergency. I quickly picked up the phone, expecting something serious. He said, "My wife is on hormones for menopause and ran out today and does not have any refills." So I asked, "Okay, what is the emergency?" He answered, "Did you hear me, doctor? My wife ran out of her hormones, and somehow I'm supposed to make it through the weekend." So I did send refills for her right away and learned a valuable lesson on how much endocrinology impacts not only the patients, but also everyone around them. Yes, hormones do carry risks, and they are not for everyone. But what surprises me is how many women I see that are not even aware of their options. Talk to your doctor, research the benefits and risks, and don't assume that suffering through menopause is your only choice. The third one is about testosterone. After 50, testosterone levels naturally decline, but low testosterone can cause fatigue, low mood, muscle loss, and reduced bone density. Men with those symptoms should have their testosterone checked in the morning when it's supposed to be at its highest. If the result is abnormal, it's important to also check prolactin and iron studies to rule out causes like prolactinoma and hemochromatosis, which can damage multiple organs if left untreated. The fourth tip is that after 50, the same injuries that once took weeks to heal now can take months, and in some cases cause chronic pain or permanent damage. That's why being aware of your surroundings isn't just helpful, it's essential. Let's start with something as simple as walking your dog. One of the most common injuries I hear about are finger fractures or sprains from leash accidents. This often happens when people wrap the leash around their fingers and the dog suddenly pulls, sending all the force straight into the small joints of the hand and causing fractures or torn ligaments. I have also seen people hurt their shoulder or even fall because their dog pulled hard. Maybe the dog spotted a squirrel or another dog or something else that grabbed their attention, and suddenly the owner is on the ground. Number 5 is also related to injuries, but I wanted to mention it separately because it is such a common injury. Be careful when using ladders. Avoid climbing ladders when you can, but if you have to use one, pay special attention when stepping down. I've treated patients who fell from a simple 3-step ladder while organizing a closet or a kitchen cabinet. Sometimes they tell me that they even forget that they were on the ladder and then they just tip the ladder and fall. Even a fall from a minor height can cause a major injury. And it's not just ladders. Everyday distractions can lead to surprising injuries. I had a patient who was walking and reaching into her purse at the same time. She wasn't paying attention, tripped on a small rock, fell face first, broke her tooth, and ended up with months of dental complications. Another patient was not paying attention while shopping at a warehouse store, and someone accidentally rolled a flatbed over his foot and crushed his bones. He has been living in constant pain ever since. The common thread in all these situations? Distraction and loss of awareness. Whether you're walking your dog, stepping off a ladder, or shopping in a crowded store, stay present, watch where you step, and take your time. These simple precautions can protect you from long recoveries or even life-altering injuries. You also have to be careful in your own home. I've had patients fall down the stairs just because their dog toy was left on a step. I've even seen people trip in the middle of the night over a pair of slippers left by the bed. These little things don't seem dangerous until they are. So keep your stairs, hallways, and bedroom floors clear of clutter. Don't leave shoes or cords near your bed where you can trip when you get up in the dark. And consider adding a nightlight in the hallway or the bathroom. Just that little bit of light can prevent a bad fall. Number 8 is about constipation. Constipation is one of the most overlooked health issues after 50. And it's becoming even more common because the new weight loss medications that so many people are using often cause constipation. So why does it matter? Straining during bowel movements create a significant increase in pressure inside the abdomen. Over time, this pressure can lead to diverticulosis, where small pouches form in the wall of the colon that can later become infected or bleed. Straining also increases the risk of hernias as the pressure pushes against weak spots in the abdominal wall. But that's not all. Excessive straining can even affect your eyes. I've seen someone require retinal treatment because the pressure from severe straining contributed to a retinal detachment. Constipation can also be a warning sign of a serious condition like colon cancer. So make sure to eat high-fiber food, drink plenty of water, and don't ignore constipation. Get it checked. Don't just assume that it's harmless. Number 9 is hypertension. High blood pressure becomes more common after age 50. It's called the silent killer because it can damage your heart, brain, and kidneys without causing symptoms. So check your blood pressure regularly, even at home. Aim for 120/80 or less, unless your doctor recommends otherwise. And finally, let's talk about NAD. We are seeing a large increase in patients using NAD+ injections, either for longevity or for conditions like chronic fatigue and long COVID. NAD+ is essential for the mitochondria to produce ATP, which is the energy coin of the cell. As we age, our NAD levels drop, which is why NAD injections give you more energy, sharper thinking, and also help the muscles recover faster from activity. However, it's important to know taking NAD+ depletes methyl groups, which are critical for healthy DNA and proper gene regulation. If these methyl groups are not replenished, it can disrupt the healthy balance and may theoretically increase cancer risk. TMG, which is trimethylglycine, helps restore methyl groups, ensuring that NAD+ can work safely and effectively. So if you're over 50 and using NAD+ injections, make sure you're also taking TMG to protect your long-term health. If you found this video helpful, please make sure to leave a like and subscribe. This is for educational purposes only, not medical advice. Thank you very much for watching, and I'll see you next time.